Hello, good morning. Well, first of all, I would like to introduce the members of our group. Sara, Monse, Fran, and Javi. And me. Well, my name is Cristina. Okay. Well, we are going to talk about general practitioner. That is a medical practitioner who treats acute and chronic illnesses and provides preventive care and health education to patients. Historically, the role of a GP was once performed by any doctor qualified in a medical school working in the community. However, since the 1920s, general practice has become a specialty in its own
We
right.
talk about point A, which is talking about defining the profession. So, what is a GP? As we said before, a GP is a medical practitioner who treats acute and chronic illnesses and provides preventive care and health education to patients. General practitioners intend to practice a holistic approach that takes into consideration the biological, psychological, and social factors relevant to the care of the patients. Their duties are not confined to specific organs of the body, and they have particular skills in treating people with multiple health issues of any age and sex, and to levels of complexity that vary between different countries. So, in what type of organizations can the professional work? Well, general in health systems of different countries, and also in NGOs such as Doctors Without Borders, Save the Children, or the Red Cross. Then, what is the salary range of a GP? Well, it is estimated that in the States, a GP may earn an annual wage of $172,000, but it will depend on the state the person works. And especially in Spain, and taking as a reference model of a professional who has worked a total of 20 years, this person will earn about 56,000 euros per year.
Well, hello, I'm talking about the point B. The first step needed for the profession is to pass the medicine degree. This degree consists of 6 years, which the first and second year are theoretical at university, blended with laboratory practice. The third year is theoretical mixed with hospital practice. In the fourth, fifth, and sixth year, theory and practice is given at hospital. After passing the degree, the newly doctor must pass the MIR exam. The mark which you get and that will determine your specialty is made by the average of your MIR exam and your academic record. To be a general practitioner, it's not necessary to get a high final mark. After passing the MIR exam and choosing the general practitioner specialty, the newly graduate become a médico interno residente that will train to be a professional GP. Each specialty has different training years. A general practitioner specialty has 4 years of training. After these 4 years of médico interno residente training, the newly graduate become a general practitioner.
Point C. The most common diseases that a GP is responsible to diagnose and treat are hypertension and flu. The most common causes of hypertension can be that there's a problem in the function of your kidneys, overweight, high levels of stress, and other previous cases in your family, or if the person smokes. For this disease, there are no specific symptoms and is diagnosed by a GP while doing a regular checkup with a sphygmomanometer. When a patient is diagnosed with the disease, the main target of the treatment is to reduce the level of arterial pressure, so the risk of the treatment of possible complications are lower. This treatment can be keep a healthy diet with a lot of potassium, fiber, and drink a lot of water. Practice exercise during 30 minutes a day, and stop smoking and reduce the amount of salt in your food. The another important and most frequent disease treated by a GP is the flu, which is caused by the virus influenza. Unlike the previous disease, this has specific symptoms as can be fever, headache, fever, nausea, and vomit. Normally, a doctor can diagnose the flu only with information given by the patient in the interview about the symptoms. Usually, they use some pharmaceutical as paracetamol, ibuprofen that helps to reduce fever.
In conclusion, a general practitioner treats both acute and chronic illnesses and provides preventive care and health education to patients. Unlike other medical specialties, they practice a holistic approach, taking into account not only the biological factors but the psychological and social too. They can work both for NGOs and health systems, and their annual wage mainly depends on the country and region. To become a GP, you first need to have a degree in medicine. Then you must apply for the MIR and according to the mark, you choose the specialty you want. Thanks for watching, and bye-bye.